Hey guys, Dr. Davalin, board certified laser dermatologist. Today we'll be talking about acne scar revision, but I won't be talking anything about lasers, so no lasers at all in this talk. Um, I'll give you a little sneak peek about my latest technique, which I have been working on for the last couple of months and have had excellent results. So that will be published in a journal next year, but it'll be on YouTube in the next couple of months. A little sneak peek here. But then after that, we'll be talking about filling. So how I perform dermal fillers for different types of acne scars. Now, this fillers for acne scarring is the way forward because it has very little downtime. Only certain types of scars can be treated, including rolling atrophic scarring and some forms of tethered scarring. Remember, it's not a treatment for everyone, but certainly in my hands, it can be a very useful treatment.
Okay guys, here's a teaser on what I do. It's called Infini or energy device microneedling. I like to use an energy device, but actually an insulated needling system. So that produces about 20,000 microchannels. Then I actually use PRP or platelet-rich plasma in an over and under technique. So over means it's actually over the top of the skin, and these actually get spread into the microchannels. If they're atrophic scars, are actually injected under the skin. Then these droplets actually get spread onto the skin surface. I then developed something called a PRP mask. So you can see me, this mask is actually infused with the patient's own platelet-rich plasma. The mask then gets placed on the patient's face, and then I infuse it again with what's remaining of the PRP solution. So imagine that you've got 20,000 channels on your face, you've got your own stem cells, growth factors, and really good stuff. And then we actually use a stocking and we actually put that on top of the face and to hold things in place for the next 30 minutes. Healing up time is within realistically 2 to 3 days, and I tell the patients don't walk into a bank within the next 1 hour, but the mask is off within an hour. So who is a good candidate for filler and subcision methods? The first thing to do is always examine under angle lighting. I keep saying this time and time again. That's why I can't actually assess just using normal photographs that people send me. I do need to actually throw the lights at different angles from all directions, and this gives me the most accurate diagnosis. So once again, angle lighting, all directions. I also get them to animate, but most importantly, I get to actually touch. So if you can stretch the skin out like this, you can see that tangential lighting, in other words, angle lighting together with the stretch method, you can see how atrophic these scars are. And these are perfect, absolutely perfect for fillers and subcision. So stretching and touching is essential. So I cannot assess these just using just by photography. You have to actually touch and feel. The second thing I do, the third thing I do is I get them to animate, so I get them to smile. If you get them to smile and move their muscles, I can see where the anchoring is and whether I need to use techniques such as subcision and how much subcision I need to actually use to actually get the end results. So remember, it's look with angle lighting, touch, and animate, and this gives me the most accurate diagnosis. So what are the different filler techniques that we use or I use to actually treat atrophic and rolling together with tethered scars? There are not many methods described in the literature. Professor Greg Goodman taught me this and published this just last year. He taught it to me about 4 years ago. It's called the Goodman's inverted pyramid method, whereby we go vertical into the actual atrophic scar. We lay a good amount of HA low and then actually reduce it as it's coming up. This is my method. It's called superficial filling technique. It's not a very hard technique. It's basically very, very superficial. Raise a bleb and then squish it down. Not too much filler should be used, otherwise you can get a Tyndall effect with this. So it's great for superficial scars. I'm not subcising, I'm just filling out these scars. So you'll see other techniques which I'll use where I actually subcise. These scars, if they don't have any give in them, in other words, there's no resistance, it's just a superficial bleb and then a press down technique. My choice of filler for this can be anything from Bolotero, but my favorite filler by far is Juvederm Vorbella, because it is very pliable, Certainly Perlane can be used, but it's a little bit thicker. And this is me doing the subcision filling technique. So here I am, I'm not injecting, I'm actually subcising. You see that? So there's no injection of filler yet. And now I'm injecting. If I do feel resistance with the needle, at the tip of the needle, if I do feel resistance, I actually subcise to break down the bonds. That's very important because when I go in there, I don't know what's going to happen until I actually fill. So this is called foundation filling. What I do is I provide volume from underneath to provide structural support. So there you see me actually feeling to make sure I'm not hitting the temporal artery. Then I'm going deep. This is laying down filler to the periosteum, in other words, down to bone, and I'm injecting a good amount of volume to actually lift the scars from underneath. Excellent technique for supporting scars. Subcision filling technique, once again, on the contralateral side, in other words, on the other side. So I am subcising. You can see me, I'm subcising and filling at the same time. So as soon as I feel that there is tethering, I'm actually breaking down the bonds. So this is another method which I use. It's called a tunneling subcision technique. So you can see me, I'm actually trying to feel, saying, hey, what's going on? Is there something holding down this, this scar? If there is, I subcise. I also tunnel. The reason why I tunnel, in other words, I go back and forth in all different directions, is to spread the filler evenly across the area. If I don't do that, then you have a big blob of filler. So you can see I'm tunneling, going back and forth before I even inject, and then I inject slowly, and then the filler actually dissipates in that area. So it's very important. Then I go back and forth again to make sure there's no tethering. This is pure subcision, so you'll see later the before and after results for this. So I'm trying to figure out where is it in that scar that has the tethering. So I'm going back and forth, and when I can find that pucker, it's done.
So there you have it, guys. That's dermal filling for you. It's my way of actually using dermal fillers to treat certain types of acne scars. Remember, please remember this. It is not the only way to treat scars. There are to actually treat acne scars to a good level, you need to actually know how to fill, you need to actually know how to subcise, you need to have surgical expertise, you need to use chemical peels such as TCA Cross. You've got to muck around with all of these or know all of these lasers, microneedling system, PRP, the whole lot. And that's when you get the best results from scar revision. So it's not just one technique, it's not just one laser, it's just the skills to actually do the whole lot. Hey, I had this guy who came to see me from all the way from Portugal, and he took a flight just to actually come for a visit to Australia, and I helped him over a period of 1 week. I can't help everyone, but lucky for this gentleman, he had the type of acne scars, which are basically the rolling atrophic together with scars around his temples, which did extremely well with just 2 sessions of fillers together with subcision. So listen to his testimonial. Once again, it's not a paid thing. It's not a advertorial. It's just his experience with what he's had with what I do. Mario, how's everything?
Yeah, great. It's
good.
Perfect results here. It's perfect.
Very good. So look, I've skeptics out there on the internet to say, hey, look, when we take a photo, when I take photos and look at the photos through lighting, it's not standardized lighting, and I say it's very, very hard to do standardized lighting because you saw me before, I use light at all different angles.
Yeah.
Now, I always say the biggest critic is the patient. In other words, it's you, right?
Yeah, it's perfect. It's perfect, man. The atrophic scars are gone. Yeah, it's incredible.
Okay, so we can see on close examination, he had atrophic scars on the temple area. I wouldn't say gone, they're markedly improved, probably about 90-odd%. He had a really atrophic scar, which was also tethered down on his forehead. And I subcised that. And how do you feel about that one?
Yeah, this one is great. I mean, it was my biggest scar, and now it's gone, man. It's gone.
Okay, yeah. That bruising there will subside. The reason why I gave bruising is because I went underneath and I subcised it. So that's totally gone.
Yeah.
The ones on his right temple, I would say, once again, I don't like to say that they're totally gone. I like to say they're probably 90% improved. The ones on his cheek, which we could see with angle lighting beforehand, I would say it's probably about 90-95% improved. So look guys, I can't do this to everyone, but for Mario who comes to see me with these kinds of scars, yes, 2 treatments and they're done.
Gone. Yeah, 1 week.
In 1 week.
Yeah.
Okay,
Great,
Mario,
man.
thank you very much.
Thank you very
man.
much.
So these are further examples of my filling technique. This is atrophic scarring together with tethered scarring. I used obviously some HA fillers, and this is about 2 treatment sessions, 2 to 3 treatment sessions. This lady had lupus, so I couldn't use any lasers. So in the end, I used HA fillers, and this is after probably about 3 treatment sessions. Really marked atrophic rolling tethered scars before and after. Not a perfect result, but look, markedly improved. No lasers were used in this case. So there you have it.
Oh, the other thing I'm going to add is this, and in all honesty, what I do is nothing special, seriously, and I'm not saying that to be humble, I'm actually telling you the truth. There are a lot of good dermatologists in the world. There's lots of good dermatologists in the world who do exactly what I do, or even better. I just actually tell it like it is and make videos on it. But there are guys in California, and you can find the links below, that are actually really good at acne scar revision and use very similar techniques as what I do to get very similar results. So hey guys, I'm not the only one. I learned from the US, seriously. So the US I think is cutting edge, but I just developed new techniques. So please, if you're in the US, check these guys out, and they can help you. So once again, it's mastering different techniques, like I said, from everything from laser resurfacing to fractional laser resurfacing to the use of TCA cross, surgery, subcision, filling, microneedling, PRP, the whole lot, even RECELL, the whole lot that actually gives you the best results. So remember, it's always the method and never ever about the device, whatever the device is. So hey guys, thanks for watching, and I'll catch you next Saturday.
So once again, just to reinforce, it's always an individual approach. What type of scars do you have? It is vitally important, like I said, that everyone examines the scar through angle lighting, animation, in other words, get you to smile and move your muscles, but also look, feel, and most importantly, touch and stretch as well. Thus, when someone sends me a photograph, I can't really comment on what is the best method, because really I do really need to actually look at the angle lighting and especially touch and animate. This gives the most accurate diagnosis. And like I said, time and time again, for the 3rd time, it's actually the method that gives you the best results and not the actual device itself. So thanks once again for watching, and I'll catch you soon. To show you how old I am, I discovered something called Instagram, and now I'm on it. So hey, if you're really bored, follow me on Instagram and I'll show you a couple of clips every week, 60-second video clips. So hope to subscribe. Thanks, bye.